Hello, it's Dr. Pat with Little Critters, and we have Daisy here, a 5-year-old Degu. And Degus are related kind of distantly to chinchillas, and they are a rodent. They do tend to live in groups or family groups. I don't recommend keeping them alone. Very sweet little rodents. They are voracious chewers, so you do need to have a secure cage. It should not be a wood cage because they'll chew right through it. You can see Daisy's very sweet and very social, but she presented today because she's been a little more lethargic. She's not running on her wheel. The owner hadn't noticed this, but she's actually very thin on palpation. Gave her some fluids here, so she has a little fluid bubble, but we can feel her spine and all of her ribs. One of the things that we worry about in Degus is they're extremely prone to diabetes due to poor diets that are too high in carbohydrates, often seed-based diets. She does get seeds, so we did check her blood sugar, and she surprised us a little bit because she is actually hypoglycemic. Her blood sugar was at 53. We did go ahead and treat that, and she was dehydrated, which is why we gave her fluids. Low blood sugar, not a common thing in Degus. Diabetes is very common due to nutrition, and low blood sugar can be caused from a multitude of problems, just like in some of the other species. One of them is an insulinoma, which we commonly see in ferrets. They're kind of the poster child for a pancreatic tumor that secretes insulin, driving glucose low. Paraneoplastic syndrome, which is cancer somewhere else causing a low blood glucose, can do this. Sepsis, so a blood-borne infection, can certainly cause it as well. And then hepatic insufficiency or liver disease can cause this. And these are all primary concerns that we have with this little one. What we've recommended is a complete profile, not just a glucose check, and screening radiographs to look at all the organs and get an idea as to what the liver looks like and make sure there's no masses. And then supportive care for her. So we're going to start syringe feeding critical care several times a day to keep her blood sugar up. We're weighing her at home. We have started her on fluids and lots of just corrective supportive TLC for this little one. As you can see, Daisy is very sweet, wonderful. Degus are great pets, but again, I do recommend keeping them in small family groups. And that's Daisy.